and then Professor Sérgio Rezende, which is the head of the Northeast Committee against the COVID. Professor Sérgio Rezende is professor of Federal University of Pernambuco, and was former Minister of Science Technology of Brazil. And then Professor Aldo Malavasi, representing the Brazilian Society for Advancement of Science, which support us in this initiative. Please, Professor Álvaro Ferraz.
Thank you, Americo. Good day and good evening to everybody. I speak on behalf of the International Institute of Physics, IIP. And let me say a few words about IIP. IIP is a research institute which besides doing research in frontier topics in theoretical physics, promotes regular international meetings, which are approved at least one year ahead of time by our international board, you see. So this is a very extraordinary occasion, because Américo Bernardes, who is the main organizer of this meeting, contacted us 10 days ago. I consulted the board. The board responded in less than 2 days. And we immediately decided to help Américo to do this conference, which is particularly important for Brazil, because Brazil is now being hit severely by this COVID-19. And we all know how important it is to follow the good examples and not to follow the bad examples that were done elsewhere in Europe, Asia, and now in the US. So the coronavirus pandemic forced the IIP to change our usual rule to approve things, well advanced in time. And I really have to thank the speakers for having accepted our invitation. Everybody has a very busy schedule, usually. Now even more with this time, when there are many of the speakers, they are helping their own countries to sort out the problems with the pandemic. So without further ado, I pass the word back to Bernardes, to Américo Bernardes, and then we'll have Sérgio Rezende, who is one of the leaders of this Science Council for the Northeast states. Thank you, Américo. Thank you, everybody, for being with us here today.
Okay, thank you, Álvaro. Thank you. Okay, I would like to introduce Professor Sérgio Rezende. Professor Sérgio Rezende, as I told you, Professor Sérgio Rezende is professor from the Physics Department of Federal University of Pernambuco, and now is leading the committee, the Northeast Committee. Northeast, the states. Okay, for most of you, I think, I don't know if you know, the states of Northeast of Brazil, they create a consortium to improve the actions of the states in many fields. And now one of these actions is the creation of a committee, a scientific committee. It's the first, as far as I know, is the first scientific committee in Brazil to support and to produce information to the governors. In fact, it's a very important initiative. We don't have this kind of initiative here in Brazil. I think that this one is the first one. And I would like to ask Professor Sérgio Rezende to give some words. Thank you, Professor Sérgio.
Can't hear you.
Your microphone is off.
Good morning, good afternoon, good evening to everyone. I would like to congratulate the International Institute of Physics for promoting this event. Very important at this time that we're living an unthinkable time. I'd like to thank Professor Américo Bernardes and Álvaro Ferraz for putting this meeting together. So as Américo said, I'm heading a committee, and I'll explain a little bit more about the history of this. Last year in August, in a meeting with the President of the Republic, with the governors, he referred to the states of the Northeast by one name, not a pejorative name. And they realized that they could not count on the federal government to help them. So the 9 governors of the Northeast area decided to create a consortium Northeast. This is legally, this is based on a law which was passed in 2005 during President Lula government. The states can have a legal organization. They can put money in a bank account of the organization. This organization can then make purchases for all states at the same time. And so the idea was to have a legal means for the states to cooperate. Well, as Américo said, 2.5 weeks ago, this consortium decided to create a scientific committee for the COVID-19. The reason being that the federal government is completely disorganized. The president says one thing, the Ministry of Health says different thing, and we are living a very, very sad time in Brazil, as you all know, especially the Brazilians. So they decided to create a scientific committee because this pandemic is something new for us and something which is not known. We need knowledge, we need science. The federal government doesn't realize this, but the governors of the Northeast decided to create this committee. I'm helping to manage this committee together with Miguel Nicoleles, who is a medical doctor, a neuroscientist, and we've been having constant meetings through the web. And after a few discussions, we decided to create 9 working groups. I mentioned just a few of them. Epidemiology, mathematical models, and measures for fighting the COVID is one of them. Biology, vaccines, and diagnostic laboratories. Support of science and research. This in particular is a working group that is composed of the presidents or directors of all state foundations for science. As the Brazilians know, some colleagues from abroad may not know, some states in Brazil have an agency for support science. And they are very important, especially in times where the federal government is not supporting science as it should, as it is occurring now. The 9 states in the Northeast, each has a foundation. So these foundations are talking together, and soon we're going to be having reports from all groups, but they are putting together efforts to have networks involving people from all states. I didn't mention the central committee, the scientific committee, is made of representatives of all states. Some states have 2 representatives, but most 1. So as soon as we discuss something and we communicate our suggestions, recommendations by means of bulletins, as soon as we have a bulletin, a representative of each government takes this to the governor, to his governor, and explains in detail, and some governments are following our suggestions. In the first bulletin and in the two subsequent ones, the first recommendation was to promote the confinement, social confinement. This is something also that the federal government is confused about. The president says that we don't need this. This is bad for the economy. The Minister of Health says we need confinement. So fortunately, all governors in the Northeast are acting together. As you know, in Brazil, the pandemic wave arrived in São Paulo, Rio de Janeiro, but now it's coming fast to the Northeast. And it's very important that the governors have decided to follow, to hear suggestions, recommendations from scientific community. As I said, this is an unthinkable time for all of us. We all knew about the influenza, the Spanish fever, and so on, but I never thought that we could live this in our time. So it's an experience, and we hope that humanity will find new ways for living this planet after we are having time at least to think more positively about everything. Well, thank you all for participating in this meeting. I'm sure this is going to be helpful. We have a working group on simulations. José Dias, who is here, and Roberto Andrade, who is here, are members of this group. And I believe that other members of the group are following this meeting by YouTube. Thank you.
Thank you, Professor Sergio. And I think that the constitution of this committee, the scientific committee, is, as I mentioned, it's a very important moment for science, and not only in Northeast, but as a kind of example for the whole country. And first, I would like to ask the participants to switch off the microphones because it interferes during the talk. Okay, I'd like to invite now Professor Aldo Malavasi, Vice President of the Brazilian Society for Advancement of Science, SBPC. We are very proud to have you here and to have the support of the SBPC to this event. Professor Aldo, please.
Thank you. Thank you, Alvaro. Thank you. Unfortunately, our president, Eudeu, he sent regards for all of you. The SBPC is the Brazilian Association for the Advancement of Science, and I'm very pleased to see one of our counselors, that is the Sergio Rezende. So, Sergio, how are you? Very nice to see you over here. So, Sergio is one of our very important member in our board that support SBPC in different ways, like what he explained a few minutes ago. First of all, I would like to thank you so much for organizing this kind of meeting. I think this initiative is something that we need to have more and more in the future. Again, it's so difficult to travel abroad worldwide. It's so difficult, to put the people together. It's so nice to see that I'm seeing here in the list like Professor Liang from China, and then people from Israel, and tomorrow people from Spain, and people from like Sergio that's in the Recife. We have Natal. We're gonna have a Brasilia, Porto Alegre. What is important today, and I think Sergio Rezende has mentioned already, is part of our job is exactly to help the policymakers to think using science. I would say that science should drive the policymakers to make the right decision. I think we need, in some unforeseen circumstances that we are facing now with the COVID-19, what we need is exactly science, solid science to say that's the way to go. in this regard, I would say that SBPC is supporting and would like to congratulate, Americo, Alvaro, and all of you to participate on that. Thanks so much for all of you in this very difficult time to coming and sit down and explain and discuss this kind of area where do we need to learn more and more. Thanks so much for the organization, and I'm sure that using our media in SBPC, we will spread out the basic resolutions, or if not the resolution, but the most important, if we can have a recommendation or something, the most important findings that we can spread out in Brazil, and also we can deliver for the policymakers in Minister of Health, Minister of Science and Technology, and and other institutions in Brazil. Again, thanks so much for IAS to organize this kind of very nice meeting, and we have our full support. Thank you.
Sorry. Thank you very much, all. I think that okay, Valdelino is now controlling the microphones. Thank you, Valdelino, for this support. And now I think we can go to the next, or the first speaker of this meeting. And I would like to introduce Professor Manchun Liang. Professor Manchun Liang is from the Institute of Public Safety Research of Tsinghua University. I apologize if I don't pronounce it correctly, from China. And Professor Manchun Liang will give a talk about what can we do to battle the COVID-19 pandemic. And okay, thank you again, Professor Manchun Liang. Good evening. I think that's 8 p.m. now in China. Okay, and please start your presentation. I think they have 40 minutes, the total time. If you give us in 30 minutes, or we can have time for few questions. Thank you very much, and Professor Manchun Liang.
Thank you. Thank you, everyone. It's my honor, and I need to share the screen. Is it okay? Can you see the screen? Is everything okay?
For me, it's fine.
Okay. Yeah. I'm Manchun Liang from Tsinghua University in the Institute of Public Safety Research. And the first is the background. IPSR, my institute, knew the epidemic since January 17. And then more than 30 staff involved in our team, involved to the research on the epidemic situation and analyze the data and develop some software system. And the main job of is the situation gather and analysis. And the second is prediction and decision support. And the third one is the emergency command system, technology system and support. And I will try to start from SARS, we call it SARS. SARS is a global epidemic, but mainly in China, and that occurred in Guangdong, my hometown in China, and in 2003. And at that time, I was a young teacher in Tsinghua University, and I saw many families suffer from the disease on TV. And some die, while some left a lifelong legacy. In fact, life in China is always safe, but SARS made me and made us, made people in China all realize that the infectious disease will endanger everyone's health and bring about death. So SARS has made us deeply afraid and cautious of infectious disease, and that's what I need to. We need to understand this. If we understood this, it will be easier for us, for you, to understand what happened in China now. Why did the Chinese government and Chinese people took the most decisive and resolute countermeasures immediately after the confirmation of human-to-human transmission? And you can understand why do the vast majority of Chinese people voluntarily follow the guidance of government and isolate at home, stay at home, and check their body temperature every day, and report to the government, and keep at home and reduce the unnecessarily going out. And then you can understand why do tens of thousands of doctors and nurses and volunteers come to Hubei province and went to Hubei province and went to Wuhan city and support them to fight the virus. And I would like to say the epidemic is wars between virus and human society. For a long-term perspective, virus always trying to mutate, to expand their living space, and why human society always protect ourselves through the continuous progress of the civilization and technology and so on. In these wars or battle, everyone is a fighter, and our common enemy is the virus. SARS and MERS and COVID-19 can be said to be the major battles in the wars between virus and human being. Each battle of the virus presents different challenges to human society. Since 2003, China has strengthened the national emergency system and designed emergency plans, including public health emergency plans. These efforts has made us, when we in face of COVID-19, compare with the SARS, we have made great progress. And the virus propagation module, we have a lot of this kind of module, but the most popular is the SERI module is the most current popular. For China, we changed the R. We separate the R into three kind of cases. One is the recovered, and the second is the hospitalized, and the third is the dead. And we also have the first is the home isolated, but it is only a few in China, and then in China the most is the third, the three recovered, hospitalized, and dead is the removed. And by setting the different parameters, the module can calculate the prediction curves with different parameters. So the module is simple, but how to select the parameters is very important. And before that, we can overview the situation, the events, the major events. On January 20, Zhong Nanshan is a famous scientist, in China, confirmed that the new coronavirus was human to human. And then the same day, President Xi Jinping of China made important instruction to put life safety and physical health first. He said, life first, health first. That's very important for the whole thing. And from January 21 to January 23, the country and the 11 provinces has successively initially launched the emergency response to public health emergencies. We go to the highest emergency level. And on January 23, Wuhan city was closed. And at the same day, emergency hospital called Huoshen Hospital began to be built. And Wuhan citizen was isolated at home. On January 24, the whole country began to support Hubei and Wuhan. And that day is the New Year's Eve, New Chinese Year's Eve. I will explain the Chinese year for you after. And on January 25, a national working group of epidemic response was established, and the government recommended that all the people in the country being isolated at home. On January 26, the second emergency hospital was start to be built, we call it Laysan Mountain Hospital. And on January 27, Premier Li Keqiang went to Wuhan to guide the epidemic prevention and all the control work. On February 1st, extension of the Spring Festival holiday. And I need to expand the Spring Festival because we are in Spring Festival holiday from January 22 to February 2nd. This is the festival holiday. And February 2nd, the first hospital, emergency hospital, was complete and put into use, and also centralized the isolation of we also centralized isolation of all suspected cases in Wuhan province into the Huosenshan Hospital, and we call it the shelter hospital. On February 3rd, was built to accommodate more patients. And on February 10th, the close manager of the whole community in Wuhan, the society will close. If you want to go out of your society, you need to some past admission. And from February 10th to 12th, all the confirmed cases in Wuhan were treated in a centralized way and gathered into the shelter hospital. And in February 12th, the doctors can diagnose the patient whether you are infected by COVID-19. Not only the infected cases, not only confirmed by the testing, also can confirm by the doctor. That's very important for us, because in that time we have no so many testing resources. And then after February 13, the epidemic situation in Wuhan gradually improved. And after March 15th, Wuhan had 0 new addition for the first time. That's the major events. Here is the maps. We can see the Wuhan's the Hubei province in the middle of China, and the transportation of the Hubei province is very, very convenient to all the China. And you can see the shelter hospital here. These two shelter hospital. And The Spring Festival transportation season, and I need to explain this. From the January 22 to February 2nd is the Spring Festival in China this year. And Spring Festival is a festival that has lasted for maybe thousands of years. Most Chinese people will gather in families to celebrate the coming of the new Chinese year. You can see the numbers from January 10th to January 27th. The country's railway, roads, waterway, and civil aviation send a total of 1.2 billion passengers. That's a really very, very huge people transportation. And this is only 4.3% decrease from the same period last year. And the close of the city on January 23 of the Wuhan prevent the potential and infected people in Wuhan and Hubei from flowing freely between the cities. And this greatly reduce the pressure of the epidemic fighting in the other areas outside Hubei province. And here is the graph. Here is the graph of the epidemic situation in mainland China, except Hubei. We can see the curve rise rapidly in the first step, and then come to the peak, and then slow down with very good shape. And we can see a red cycle here in the right side, on the right side. Yeah, the peak over there is, we call it the special crown. This peak is because the prisoner, the people in prison, they have hundreds of people in the prison, so we get this peak. And we can see the graph. We can see the graph, and we can see the major events here. January 23, we start to close the city, and then the testing, because of testing, the curve rise rapidly, and then after we can find out most of the infected people, and then the peak occurred, and that's a very good very good thing on February 3rd, the day. And after that day from February 1st to February 6th, it's a very hard time for the people in mainland China, except Hubei. And after we see the curve after the February 8th, we see the curve slow down. So we know that the epidemic in mainland China, except Hubei, becomes better. So after that, more and more people more and more resources can gather to Hubei province. And we know that Hubei province and Wuhan city is the most problem of us. And why is it important for the public to stay at home? Because in the whole China, we can see the curves, and it depends on every person, the whole public staying at home. And in fact, in the Spring Festival, traditional way, my family will go out to relative family, and we gathered, we go together and celebrate and say hello, say 恭喜. We call it 恭喜发财, and to the elders, and with good wishes to the elders, and then we can get some lucky money. That's. But in this year, we stopped the traditional way of that. We only use the WeChat, WeChat to bless the elder people, and we don't gather together. And because we stay at home, and the susceptible person and is close is break out. So we reduce the beta very much. In that time, we have a saying, and we have a saying, we call it, we believe that if we persisted for 15 days staying home, the epidemic will lose, and that is the virus will lose. And I also published an article and say that insisting 15 days and situation will turn better. By that, because the incubation period of this virus is very long, the average time from the infection, the average time from infection to onset is 4 or 5 days, maybe, the average time. But with most probability about 95%, the time is 14 days. However, as far as I know, there are 27 days incubation period cases occur in Hubei province. So in so a long day, you have no idea if the person you greet, the person you shake hands or you hug, whether he is a virus carrier. You don't know that. Therefore, we need to reduce the unnecessary going out things, unless you need to shopping something, you must go out. But if not, you just stay home. And in fact, I stayed home for very long time, and because I'm very worried about my parents and my kids. And when we must go out, and we cancel the handshake ceremony. We don't shake hands with others. We always use the very traditional Chinese traditional way, like that. Say hello. Yes. So we don't need to touch each other. And also we use the mask. I see the news, maybe in the other countries they don't like the mask. They don't like to wear mask, but it's very important, I think, to wear the mask. And in that days, we always wearing the mask, and it's important because it can reduce the transmission of the and reduce the little thing in the air, and it also can prevent us. It also have an important things to prevent us to touch my mouth. If you have a mask there, you can touch your mouth, because you can touch your mouth, touch your eyes, because your hands maybe touch somewhere and touch the virus. But if you have mask, you can prevent you to do that. And because everyone have the habits like that, you can prevent this. So we always use the mask to protect ourselves. And the problem in Hubei province and Wuhan, we can see the map here, and this is the Hubei province, and can you see my mouse? The Wuhan city is here, and Hubei has a population of 59, almost 60 million people, and Wuhan has a permanent population of 9 million and a floating population of 5 million. That's the numbers in the end of 2019. So that's a lot of people. And after the close of Wuhan, we think there are 11 million people inside the city. Here is the graph of epidemic situation in Hubei province, except Wuhan. And we can see the curves is something like it is in the same shape. You can see that in the same shape, but the peak day will move to the February, maybe 6 to 10 is the peak day. And here is the peak. Here we can see a very high peak here, and we can see more higher peak in Wuhan city. Why is this peak? Because we can see the curve here. In the first stage, we have enough resources, and we can see that the numbers of confirmed case increase rapidly, and till February 4th, and then it becomes flat. The curve becomes flat. This flat is when I do the prediction curves, I found that the flat is not good, because what I think the reason of this flat platform is caused by the lack of resources, of lack of the testing kits, testing resources. And it's true in that time, Wuhan city have very hard time in this period, in the flat period. It's a very, very hard time for them, because maybe they have no so many hospital beds for the patients. And you can see in February 12th, this peak is made by a decision. This decision is that the confirmed patient can be confirmed by doctor. You don't need to test. You don't need the test kits. In China, we always use 2 test kits to confirm the case. But in that time, if your daughter say, Zhaji, the doctor say you are confirmed, yeah, you can be confirmed. So the doctor confirm a lot of case over there, because the doctor can see the CT graph and can see your they have the experience how to decrease the whether the patient is infected by the COVID-19 by the virus. Yeah. So we can see this peak. And in that time, the whole country become very, very nervous because of the number rise so high. But for me, I think that's a very good thing because we have found out so many people, so many infected patients, and we have gathered them in the shelter hospital and make sure they have get the better care and so the better care. And then after that, almost all the people, the most of the infected patients have found out, and then after a week of in the February 20, the number decreased very rapidly and return to the prediction curves. You can see the purple curve is that purple curve is our prediction curve, and it reduced to the purple curve, and then everything get better. This is the effect of the transportation. Among those, before the Spring Festival, I have told you many people returning home from the city of Wuhan. The proportion of people returning city of is the Xiaogan. Here you can see the first city is Xiaogan, the second city is Huanggang. These two cities is the most proportion of people returning from Wuhan, and then these two cities is also the highest number of infected cases in Hubei province. All the numbers from the Wuhan, from Hubei province to the other cities can be the data we can find the data by the in several ways, so we can evaluate the influence of the transportation. And that's a very important. Another important thing is testing. When we don't know about the situation, we keep people staying home, and then we need to testing and find out the E and I. And if there are not enough testing kits, we choose to believe in doctors. What doctors say, this patient may be infected by the virus. We choose believing the doctors. By this, we can find out the infected people. And then trace and isolation observation is also very, very important by the investigate and what kind of the public transportation you have used, what place you have been to, and we do a lot of investigate and try to find out everyone who may be in danger and find out and isolation them and isolate them in a home or at the hotel, and keep observation of their temperature. That's a picture you can see when the isolation of patient or the isolation of the observation. There are a lot of people volunteer to send the food to their door, to their house, and they also help them to drop the rabies, deal with the rabies. Yeah, so everyone can stay home if they are need. They can stay home safe with enough food, enough water. The other thing is the protection of doctors, nurse, and emergency work, such like police and logistics. It's very important because they are the most important resources to fighting the virus. And about us, we are the technical support teams. We use different modules to tackle the curves. I think the hardest for us is how to choose the parameters. And the second important thing is we need to find out how to speak, how to communicate with the decision makers. If we only show the results, of no epidemic, no countermeasures, we can see the numbers very high. Yeah, we are right, but the decision maker may be disparate, and maybe they don't know how to make the decision. That's so sometimes we need to show them if we have some countermeasures, like these countermeasures, and maybe the curve become this way. We show different countermeasures, different curve, and they can make the decision. And the second, when we give the prediction curves, and we need to explain the hypothesis very clearly for them. And the third is we can select the module parameters according the actual situation of our countries. It's important, and that's my speech. And thank you very much for my poor English. Thank you very much. That's all.
Okay, thank you very much, Professor Liang. It was very nice to listen your talk. And we have a question from people who are watching from YouTube. I think that in the slide 14, Júlio César asked about this peak in the curve. Slide, yes, this one. In this peak, what the origin of this peak? Is this peak produced by the change in the test to detect coronavirus?
Yeah. The peak. How to explain this? I try to explain this. Okay. You can see the purple curve. The purple curve is my prediction curve, and we can see that the actually curve of the blue one is actually daily confirmed patient. And if the daily confirmed patient, we can confirm it, we have no enough. If we have not enough testing kits, some patient he went to the hospital, and maybe their daughter believe they are confirmed patients, but before the day, the confirmed standard of national confirmed standard is we can only confirm by the testing, and after the day, the national CDC change the confirmed standard, so daughter can confirm the patient, and then the daughter know they have a lot of case. They have a lot of case. They are cheating. The daughter are cheating. So they gather the case and all confirm on the day to February 12th. I can speak more professional. Sorry.
Okay. I have a short time, but I would like to ask you if someone which will participate in this room have one question to the Professor Liang.
Please.
If you do not, okay. I thank you again, Professor Liang. Let me ask one final question. I think that the most of us in Brazil worried about when you finish the isolation in the Hubei, in the Wuhan, and start the relaxing the isolation measures, the restriction of movement. Do you think that you can have infection cases in the other states or provinces in China? How are you doing with this kind of problem or this kind of situation? Are you worried about this?
Yeah, that's a good question. Yeah, we do worry about that, and as I have told you, the government, the Chinese government, and Chinese people are very afraid of the infected disease, and we are very cautious now, and we do open the society, open the opening of the factory, and opening of the work. We do it very cautiously, and we do it step by step. Some area opening first, and then more open, and then we observe the numbers, observe the infected case, and then we truly found the case who is infected but who have no fever, have no, who is normal, and then these kind of people we found out, and maybe we have a lot of this kind of patients, this kind of cases, not patients, cases, and we keep observe them and how they can carry the virus for so long time. We change to the patient, and we keep checking this and make sure the whole society, the most of people become safe. We do a lot of job on this for the safe, yeah.
Okay, finishing this session, Professor Liang, thank you very much again for your participation. This talk will be available to the people at YouTube and other people. This talk will be available at the site of IAP, and I would like to talk. And we are moving to another session. The link was written in the chat, and we can move to this link now. Okay, we are closing this session, and we will open a new session with the link written in the chat. And Professor Sebastian will start the next talk. Okay, thank you very much again for all. And people at YouTube, you can continue at the same link. You don't need to change the link. Only people at Zoom will change the link. Thank you very much. I ask Valdenilo to close the session and to open the new one. People must move to new link. Thank you very much.